Are you struggling with your weight? Do you know about the ketogenic diet? Have you heard about calorie in and calorie out and very confused about what to do? Well, maybe we need to understand what's happening. Stay tuned. Do subscribe and click the notification bell so that you are updated with our videos. We'll be talking about weight and weight loss. I'm Dr. Mazhar Hussain, and we'll be talking about how to understand what's happening in our body. This is unfortunately something that is quite true. We don't really appreciate health until we lose it or we get sick. We realize that, okay, it's something that's really valuable. But I think this is an approach that we need to change. So when you talk about weight loss, I often hear patients talk about food and exercise, and in combination or separately about how to lose weight. And there's a very rigid way of thinking about weight loss and about weight gain. So I'm trying to challenge that in this video. So if the traditional way we think about it is like something calories in, calories out. It could be a ketogenic diet, intermittent fasting, extended fasting, meal plans, fizzy drinks, should you avoid them? There's this Atkins diet and ketosis, fat adaptation, exercise, and so on. But the question is, we need to actually understand what's happening. First of all, why are we overweight in the first place? And what is happening to our body? If you look at this, all of these six situations can cause weight gain separately or in combination. And they can cause all of these issues, or some of these issues. They may not cause all of them separately, but they can cause some of these issues directly or indirectly. Let's say hypothyroidism. You can gain weight with that. If you're vitamin D deficient, you can gain weight, but you can also have a sleep disorder due to low vitamin D. Low testosterone can lead to weight gain. It can also lead to sleep disturbances. Sedentary lifestyle can lead to weight gain, and vitamin D deficiency can also lead to a number of problems that are kind of in the same region that we've talked about. So if you just take vitamin D deficiency can lead to depression. It can lead to weight gain. It can lead to poor sleep. These can also lead to a number of other problems. And all of these symptoms are some way connected with each other. There's some, if you have sexual problems, you might have depression. If you have depression, you can have sexual problems. If you have poor sleep, you can have heart disease and you can have hypertension. With poor sleep, I haven't even got that arrow. I haven't got all the arrows that really are needed. Poor sleep can lead to sexual problems. A sedentary lifestyle can lead to weight gain. Weight gain can lead to low testosterone levels. So it's all just a mismatch, and we need to understand what is happening in the body before we start trying to solve the problem. If you look at testosterone, the slide is exactly the same. I've just changed low vitamin D with low testosterone. So low testosterone can lead to depression. It can lead to weight gain. It can lead to poor sleep. Those problems can again lead to all the other things that we talked about just now. So it's important to know what is happening in our body before we start trying to treat it. If we are cold in a room, there can be many reasons why we feel cold. It could be because the doors are open and it's freezing outside. It could be the windows are open. It could be that the temperature on the heaters are set too low, the thermostat is set too low. It could be we accidentally have put the air conditioner on cold rather than on heat. It could be due to not even something with the environment. It could be because we have hyperthyroidism. That can lead to feeling cold. If we are having a calorie restriction diet, it can also lead to feeling cold. So why is it cold? Well, we have to find out why it's cold. There could be so many other reasons also that I haven't stated here. But this is just to give an example and an understanding that we need to know what's happening. If a business is down, there could be many reasons why it's happening. It could be fewer orders. It could be that the social media campaign that was set up is for one reason or the other shut down. It could be there's lack of fund. Maybe the credit card has expired. It could be there are new competitors in the market. They're trying to get into our domain. It could be our prices. It could be the economic crisis in the country, or maybe within our customers. And maybe the customer's needs are changed. We can't just look at one factor and say, well, this is probably the reason. We need to understand what's happening. It's not any different when we gain weight. We need to understand what's happening in the body and what to do about what's happening. We need to know what the basic causes are. So the question we need to ask, why am I overweight? What is it that's happening in the body that is leading to overweight? Of course, we can't cover that. We can't cover it for all the patients, and we can't even cover reasons for being overweight. But it's the mindset I want to present, that we need to look into what is happening rather than trying to just jump directly to treatment. And we need to diagnose, we need to know what's happening before we start fixing it. I had this lady in her 20s. She had been to nutritionists, and they would give her a meal plan, and they would give her some advice on exercise. She had been to doctors, again the same, some advice on how to reduce the calorie intake and how to exercise more so that the energy usage is increased, so the calories in, calories out. But nobody really bothered to find out what's happening with this lady. Now, the blood test showed she was iron deficient. She was hypothyroid. She had vitamin D deficiency. And sleep disorder is, of course, not a blood test. But she also had increased inflammation level. Now, vitamin D deficiency, being hypothyroid, as we saw just before, they can both lead to weight gain. And it's so much harder for her. It's not just enough stopping the junk food. Well, of course, she has to stop the junk food, but she also needs to fix what's wrong with the body. She needs to do something with her iron deficiency so that she's not so exhausted and tired all the time. She needs to fix her sleep disorder. The sleep disorder could be due to the vitamin D deficiency. So things really need to be clarified before we start treating them. We had this young man in his 30s. He was nearly 180, nearly 6 feet tall, and he had his weight was 110 kilos. We did his blood tests, and he had a borderline fasting insulin level, which is not okay. He had vitamin D deficiency. ALT, which is a liver test, was increased, indicating liver damage. Sleep disorder is still not a blood test. And he had folic acid deficiency, and he had increased inflammation with the C-reactive protein. Now, this young man would be struggling to try to lose weight because his body is not ready for it. So even if we give him a meal plan that makes sense, whether it's the ketogenic or whether it's the calories in, calories out model, if it's the Atkins or if it's intermittent fasting, his body will resist weight loss. He could be doing everything we ask him to do, but he might still be struggling very hard. And the same process that could have been helped out by helping him with the folic acid deficiency, with the vitamin D deficiency, it could maybe have been so much easier, and the compliance from the patient's side could have been better had we looked into that. We had this lady, she actually came to me because of hair loss, and when I inquired more into her situation, it appeared that she was actually suffering from depression, and she was also having a sleep disorder. When we did her blood tests, we found iron deficiency, increased inflammation with the C-reactive protein, vitamin D deficiency, and no doctor has bothered to look for diabetes. And we found folic acid deficiency. So although she had been to nutritionists, she had been to doctors repeatedly, nobody really bothered, apart from talk about her hair and giving her some vitamins and some advice, and about her weight, just giving some advice about the meal plans and the food and the exercise. But something's happening in her body. And there's one thing more to remember. She's 164, her height is, which is just 5'6". Now, 76 kilos, she is an Asian. An Asian has other requirements for their BMI. A Caucasian can have a BMI up to 25 and will consider it from a medical perspective to be normal weight. An Asian cannot really cross 22.5 in BMI, because then they will go into overweight, and if they cross 25, BMI of 25, they are going into the fat category. Asians cannot take overweight at all. So the ethnic aspect is also something that needs to be considered. Anyway, what I'm trying to say here is we need, before we start talking about health, weight loss and so on, we need to know what's happening in the body. It's not enough that we just give our verdict on how to eat. We need to know whether that's actually what is needed in this situation. Well, that's all for now. Do subscribe and click the notification bell and stay updated with our videos. I'm Dr. Mazhar Hussain, and I'll see you in the next video. Thank you.